Welcome, Dr. Almeida. This is a podcast to go over functional medicine from a vascular surgeon standpoint and the need for true functional integration with a traditional medicine practice. So, Dr. Almeida, welcome. Thank you so much for having
Oh,
me today.
yeah, great. Thanks, Crystal. This will be interesting.
You're a vein pioneer. So, who better to pioneer the wellness space than you? So, tell me, really, what is functional medicine to you?
Well, I'm not pioneering the wellness space. This is a space already. It's such a broad term, wellness. It can mean anything. And of course, you got biohackers, non-physicians to all kinds of physicians doing this now. It encompasses everything, I think, anti-aging, functional medicine, integrative medicine, longevity, anti-Western medicine, holistic medicine. To me, it's kind of all the same type of approach. So we're calling it wellness slash functional medicine. Actually, there's a device that we're using, and they just brought in some new applications, and they're calling it their applications functional wellness. So however you want to call it, doesn't really matter. For us, the main reason is kind of circumstances dictate actions and decisions and what you do. So let's just go back a little bit. I'm a traditionally trained vascular surgeon, fellowship trained vascular surgeon. I got out of training doing the big cases, the aortas, the emergencies, the hospital. And I was solo for 5 years, covering 8 hospitals, and really needed something for my own life. I just felt like a slave, wife of 4 kids, a marriage is suffering. I'm angry. And then just serendipitously, I was just, how do I get out of the emergency room? And came across a small course by Ron Bush on how to do in-office vein stripping with tumescent anesthesia. This is before RF and laser. I just wanted to get out of the damn hospital into something with a better lifestyle. So I started that, and then 1999, RF ablation was approved, and I just did one case, and I said, that's where I'm going. So dropped, my last aorta was in '03, and veins have been pretty good. And around '05, '06, got reimbursement. We're getting paid pretty well. The lifestyle was good. But the last few years, we're just getting pounded with reimbursement cuts to the tune that I'm making half of what I did 10 years ago, working just as hard or a little harder, more office staff to deal with all the insurance, pre-authorizations and appeals. And so lower reimbursement with higher overhead equals a decreased margin. And the squeeze just kept coming until, look, we need some other revenue source here to maintain this practice. And that's when things just started piecemealing together. It was really my wife Yvette who saw it before I did. She's the one that runs the business and pays the bills, and pushing me to start doing these other things. And look, I'm my brand. I'm a vascular surgeon. What do you mean get into cosmetics and wellness? So we kind of started easy from laser hair, tattoo removal, then bioidentical hormones. So, I mean, we started this a good 10 years ago, and it's just kept building on it. The actual wellness or functional medicine came of interest to me because I became a gym owner, and then I wanted to convert it to a medical gym. I started doing videos to educate our gym members on things like how to eat, nutrition, how food gets processed through the metabolic system, and of course the exercise piece. And that really is the basis of functional medicine. It's the lifestyle piece. You need what you've heard your entire life: eat well and exercise. So that's where it starts. And then currently we're in the doing this. It's called a year-long mentorship. It's online with a functional medicine doctor who's been doing this for 30 years. And his approach is lab-based functional medicine. So learning how to do all these labs, how to interpret them, and then how to treat that based on the lab results, usually with supplementation. So that's kind of where we're at. I've been done several Institute for Functional Medicine courses, done other things the last few years. But this is what I'm currently doing now because it makes sense to me to take the treatments based on lab results. So you're not just throwing vitamins in the wind. You're really targeting at least the problems that you see.
From my clinical experience, when I'm seeing patients for follow-ups after we've done the ablations, they still have edema, recalcitrant edema. And so I'm always, did you see your endocrinologist? Have you been here? So functional medicine to me is par for the core when we're dealing with patients in general. So I love the model that you're bringing to the table with through your mentorship is the lab-based, really looking at the molecular structure, really how things are functioning through the Krebs cycle and how we can pinpoint, because EMA is a catch, is it cardiac, is it renal, is it food, salt? And so I find it a natural progression and something that I've always been interested in. And for me personally, I thought I was healthy, and then we did the labs and
Right.
not so much. So
Yeah.
I really see it as the future of medicine. That's why I said the vein pioneer, why not be the wellness pioneer to marry this new train of thought with traditional medicine? So how do you see that for the future?
Yeah, well, so as you as patients, you're going to see a lot of people coming in with leg swelling, and you work them up and a normal venous system, and it turns into a fluid retention conversation. Why are you retaining fluid? And as you just stated, that's so broad. It can be anything from salt intake, overweight, lack of activity, basically any medication, cardiac, renal, hepatic, anything. A lot of it is diet, and people are overweight. And this fat, not so much subcutaneous fat, but you start learning about visceral fatty liver, all the I've heard of called overnourished, people that are overnourished. Nice way of saying you're taking in too much energy, food, and you're obese. Those calories, that energy doesn't get burned, it gets deposited. And when it's not going subcutaneous and it's actually going visceral, which can be livers, fatty livers is an epidemic. That's all inflammatory. It gets in the muscles. That's inflammatory. So it set up this inflammatory cascade, which causes all kinds of things with the cytokines, and oxidative stress is a term that's being thrown out there a lot. But you see it every day. Just folks that are coming in for a variety of things, thinking it's circulatory, and probably something systemic is going on. I think so you'll hear Western medicine or us conventional medicine people or disease-based medicine. And it is true. We treat when disease is obvious. It's either found on a lab or an imaging study or something obvious on physical exam. That's what we're trained to treat, not when everything is negative. So all the conventional testing is negative, nothing shows up on imaging, the patient's not feeling well, and we just listen, we didn't find anything bad. We'll see you later. And they go seeking. So what's interesting in this mentorship, it's not just MDs. There are naturopaths, so there's acupuncture people, there's physical therapists, or you don't need to be a doctor to do this stuff. Most of the things we're prescribing in this course, there's other things where you need to be a prescriber. But at least this course, you don't need to be a prescriber. So it's mostly how to use supplementation based on lab abnormalities. There's different levels where we get into peptides where you need to be a prescriber, bioidentical hormones, you need to be a prescriber. Weight loss, of course, is a big one with a GLP-1 agonist. That's a huge one. You need a prescriber for that. GLP-1 agonists are being found to not only help with weight loss, but reversing hyperinsulinemia, congestive heart failure, hypertension, hypercholesterolemia. It's the new wonder drug. It's the new penicillin. And we're on tirzepatide, which is GLP-1, GIP. I think there's 20 already in the pipeline,
Yep,
20.
there's some new ones that prove
Yeah.
to be even more.
Exactly. These things are just going to keep getting better and better, and their applications are just going to be broader and broader for general health effects. Barring any disaster on a clinical trial, these are going to be the new wonder drugs or metabolic reversal agents in addition to other things. So I think it boils down to learning what metabolism really is and what it's supposed to do, and how to identify when it's not doing what it's supposed to do and help it along, which is usually taking care of deficiencies that we see on the lab results.
Why don't we talk a little bit about the gut microbiome? Because along with the GLP-1s, there's all this new research coming out that answer all of these things, and it's all going to the gut microbiome. Let's talk a little bit about that because butyrates, all of those things, the natural GLP-1s. What are your thoughts on that?
Yeah, that's a massive field now. And if you just can, the numbers are what I've read other numbers, but the ones that kind of stick with me are the human body has about 37 trillion cells that we can call ours. The microbiome, of course, lives from the lips through the esophagus down to the anus, plus the skin on the outside. So there's probably around 100 trillion more cells that we call microbes they're with us. And if you look at the amount of genetic material in what we would call our body, which is us plus these microbes, 99% of our genetic material are the microbes. So just let that sink in a little bit. That's just crazy. So we live in symbiosis with these bugs. Some of them are commensal and necessary, and some of them are, that can cause pathology. But yeah, you just mentioned the butyrates, short chain fatty acids that are products of these, let's just say, a microbiome in our GI lining, which is the main one. I forget how many species, but 300, 400, 500 species of these microbes just in our gut. And things like short chain fatty acids, the most famous being butyrate. There's others. And these molecules circulate and, to our brain and affect our mood. So, your mood can be based on what your microbiome is like. And of course, you start taking antibiotics for infection, you start disrupting the microbiome. So prebiotics, probiotics become popular. The main thing that they feed on is fiber. There's soluble and non-soluble fibers, but that's the main food for your microbiome. So that's why fiber is such an important part of the diet. But yeah, go on for hours and hours. But I think to your point, any G infection, just broadly called dysbiosis. Dysbiosis, the worst ones would be, another bad one that's common is H. pylori. These can be treated with herbals or with antibiotics, depending on if you're a prescriber or not and what approach you. But yeah, if oxidative stress or some disruption to homeostasis is going on in your body, say fatigue. We talk about this in our Wednesday classes. Fatigue can be anything, that can be anything. All these vague symptoms. It's the gut infection, all of the inflammatory processes that then cause oxidative stress, then cause, end production, which gets to your fatigue. So this business of root cause, I don't know that that's accurate. It's a sexy term. Well, my doctor, the pills didn't get to the root cause. That's what the criticisms are. But I don't know that we ever really get to the root cause. I mean, fine, and with these symptoms, but that's why I like the at least you can start finding things that show up on labs and different types. So the main ones that we're using are cortisol, called an adrenal. Uh, there's a cortisol awakening response. It's a whole adrenal panel based on cortisol and DHA and the levels. So based on that, we start a program to treat the adrenals. There's to it. There's some brain markers that show up in the organic acid labs that help us use some amino acids like tyrosine and 5-HTP to treat dopamine or serotonin metabolic abnormalities that show up on the tests. There's saliva, urine, and stool. To get blood tests, use it for other things, levels and other things, heavy metals. But just like the basic to start, you can do with saliva, stool, and you have three tests, the GI and the organic acids. And with that, you can really start getting a sense of the stress response, the GI response, what's going on with toxic, they need a detox program. So that's based on some liver metabolites. We look at the entire pathway from food breakdown, whether carbohydrate, fat, or protein, and as things travel into the cytoplasm for either glycolysis or get the carnitine to take the fats into the mitochondria. But from cytoplasm to mitochondria, Krebs cycle and oxidative phosphorylation. Those are the enzymes that we track on the organic acids, and based on the byproducts, the metabolites, we can find disruptions in the chain and start replacing those. A lot of them is just plain old B vitamins, magnesium, CoQ10, but there's other things. But the point is that we're not just say here's a multivitamin or take these or curcumin, just these random things. No, here's your lab. These are the markers that are showing up. These are showing that this B vitamin, you're not getting enough of that B vitamin. You probably need some of this here, and then maybe retest in 6 months and kind of go that. So there's overnight changes. Most of these programs, with one, and then a couple months in, you change up from, for example, adrenal to a brain and add GI, and it's about a year of taking supplements. So it can be, expensive out of pocket the first year, but then things should start straightening out in the labs, and hopefully the symptoms also start to straighten out, and then you can get them more into a maintenance phase. And they should be able to kind of until the big stressor comes in, be it emotional, death in the family, infection in the gut, can be anything. But really, we're just stress and cause all these changes in the body that show up on labs.
How easy is this to implement in a practice?
Of it is a cash model. There's a few things that we do through insurance. The conventional labs, like your metabolic profile and hormone levels in the plasma, also kind of major disease before you start something like this. You don't want to miss anything. For example, if you're starting somebody on hormones, you want to have a PSA in a man and things. But the way we do it is it's a combination of conventional and functional. It's not just pure functional. So it's easy to implement in the sense that you've already got a practice, you've already got a staff, you've already got a patient base. Is in that vein practice over here, and I'm trying to learn more here, and me to break away from the veins to see the patients over here. It's hard. So we have a nurse practitioner, we have a PA, we have a esthetician, we've got nurses, medical assistants, a couple ultrasound techs, and they all our ultrasound techs help run our DEXA scanner. We have a DEXA scanner for our weight loss patients to track lean and fat mass and visceral fat. So you kind of practice. Of course, we're trying to get a satellite office going with you up in Jacksonville. Um, for me, and it's a lot of it for me is delegating, which is good because part of what I want to do is to internal scaling, I guess, where I got some other things running that I don't have to be doing myself, like surgery. Surgery got to be there, my hands got to be moving, and so things that are going, I can be doing surgery, and these other things can be going in the office. So we're leveraging a revenue stream that otherwise wouldn't be there.
It's an easy way to scale, in other words, and not just that, but also really help the patients that are already coming to your practice.
Yeah, so say 20 years ago, leg pain, I got some swelling. Well, you got a negative ultrasound. See you later. Now it's look at some other things. Looks like you're retaining fluid. Something happened, and you start into it with them, and there's going to be all kinds of reasons you find it's why they're retaining fluid. I mean, the biggest one for a vein patient, they come in with that it's not the plumbing. So those tons of that and tons of overweight patients. So we got the weight loss program. So yeah, you in your practice, it's a matter of from one room, one focus to another. And the other thing is on vein consult. When we schedule, I have time to get into a functional medicine consult after vein consult. So listen, this doesn't look venous. You have these things. Would you like to see our nurse practitioner who can work up these other things in our functional or wellness program? And then they get set up in a separate consult. She'll get things rolling. And if she needs to consult with me, in and look at labs together or get a treatment plan. But she does all the follow-up and a lot of the, call therapy that's required. You got to talk to these people. and follow up and text and emails. I want to do that part of it. So it's good to have help to scale it, as you said.
I think that's a lot of information for our first podcast on wellness. So thank you so much. I appreciate your time, and we'll schedule our next one to go
That,
more in depth about what wellness really is.
that sounds great, Crystal. Look forward to it.
Thank you, Dr. Almeida.
All right.